Stephanie.
Hi.
How are you?
Good, how are you?
Good, thanks. I'm a nurse practitioner student at Mass College of Pharmacy.
Okay.
Today I'm going to do a focused assessment on your cardiac and peripheral vascular system.
All right.
So what I'm going to have you do is lay down as I wash my hands over here.
Okay.
All right. Wonderful. All right, so just starting off, the assessment always starts with inspection, and I'm taking a look at your chest right now. I don't see any obvious heaves or pulsation, so everything looks normal there. So what I'm going to do is assess for jugular venous pulsation, and I need a ruler to do that, and another straight object, so I'm just going to use two rulers.
Okay.
I'm going to come down close to you, and I'll have you turn your head to the left just slightly, okay? So what I'm doing here, I'm looking for the internal jugular vein, the pulsation of it. I'm going to take a ruler and put it on the sternal angle, and then my other straight object, line it up to see how far up the vein is pulsating. All right, so I've got my measurement. It's about 2 centimeters, which is absolutely normal. So the jugular venous pulsation is 2 centimeters above the sternal angle at a 30-degree angle,
Okay.
so that's very normal. All right, so moving on, I'm going on to palpation. I am going to palpate the precordium. So I'm going to start at the apex of the heart, okay, the left sternal border, and the base. Okay? So I don't feel any obvious, or I don't feel any thrills, pulsations, or heaves, so everything looks normal there. Now what I'm going to do is find the point of maximal impulse, or the apical impulse. So if you inhale deeply, exhale, and hold your breath for me. Okay, right here. Great, and exhale. All right, so I'm finding your apical impulse at the fourth intercostal space, the midclavicular line, which is totally normal. Okay? So now I'm going to palpate your pulses from head to toe. So I'm going to start with the carotid arteries. Okay? And the other side. And the carotid arteries feel equal bilaterally, 2+ pulses, which is great. Now moving on to the brachial artery. All right, I want to see your hand over brachial. Now the radial artery, and the ulnar, and the radial here, and the ulnar. Now moving to the femoral artery. Good. And moving to the popliteal under the knee. Just relax. Okay, and under the knee here. Good. Now I'm going to take off your socks while I palpate the dorsalis pedis, and then the posterior tibial. Good, so all your pulses are equal bilaterally, which is great. Well, now while I have your socks off, I'm just checking for edema. And you have no edema, no tenderness, swelling. Now I'm going to check for deep calf tenderness.
Okay.
So I'm going to bend your knee up just slightly and tell me if you have any pain or tenderness
Nope.
here. Great. And then the other one? Any pain or
Nope.
tenderness? Wonderful. All right. I'll put your socks back on.
Okay.
Thank you. Great. So you were just sitting up. I feel bad, but if you could sit up again for me. I'm going to listen to your carotid arteries.
Okay.
I'm going to clean off my stethoscope, and I'll use the bell of the stethoscope to listen to your arteries. Okay. So we'll have you take an inhale, exhale, and hold. Good, relax. And do the same thing. Hold your breath on the other side. Good. Wonderful. I don't hear a bruit, so everything looks normal. I'm going to have you lay back down so I can listen to your heart sounds. I'm going to use the diaphragm and the bell of the stethoscope. So I'm going to start with the diaphragm. Okay. The aortic area, pulmonic area, tricuspid area, and mitral area. And then with the bell, aortic, pulmonic, tricuspid, and mitral. Good. So your heart sounds regular. It's about 65 beats per minute, which is totally normal. S1 and S2 are completely normal. I don't hear any murmurs or extra heart sounds. S1 is a little bit louder at the apex of the heart, and S2 is louder at the base of the heart, but that's completely normal. Okay? So I'll have you sit up again, and I'm going to assess for aortic regurgitation. So I'm going to focus on the aortic area of your heart with the bell or the diaphragm of the stethoscope. And I'm going to have you lean forward a little bit. Inhale, exhale, and hold it. Okay, and relax, breathe. Good. I don't hear any late diastolic murmur there, so you don't have aortic regurgitation.
Okay.
And if you lay on the left side of your body with your feet up, I'm going to assess for mitral stenosis with the bell of my stethoscope. Okay?
Okay.
Just relax. Good. And I don't hear a murmur there, so
Great.
everything looks normal.
Okay.
All right, well, have a great day. Thanks
Thank
for
you.
letting me assess you.
Thank you.
Okay.